Good afternoon, everyone. Thanks for being here with us on a kind of a rainy Monday afternoon. I hope everyone had a good weekend. We've got several things to chat with you about today. Of course, COVID numbers, vaccinations, and we'll take your questions, of course. So COVID numbers today, some of you may have seen this on the national news. Our numbers are ticking up a little bit, or maybe I should describe it as a plateau. And I'll just show you this one slide, and I know this is not easy to see on here, but take a quick look there, and what you see towards the end of that graph is a little uptick in the numbers. And these are regional numbers on the graph, but our own city numbers reflect a similar uptick in terms of new cases. The city of St. Louis is currently averaging 29 new cases a day. That had been down as low as 20. Looks like maybe 19. So yesterday we reported 25 new cases. The day before we had 34. The day before that we had 44 and 38. Those numbers are still good, but we are concerned about the recent uptick or plateauing of these numbers. We had been having such a steep decline in the numbers, and of course we were hoping that that would continue, but this past week it has not. Now, hospitalization numbers are still excellent. We don't want anyone in the hospital, of course, but currently hospitalized in the region 267 people. 72 of those people are in the ICU. 45 of them are on ventilators. And in terms of patients admitted to the hospital each day, the region is averaging 37 people admitted to the hospital. St. Louis numbers continue to be the best in the region. We are averaging about 10.5 cases per 100,000. State of Missouri is averaging 11. St. Louis County is at 16. St. Charles is at 16. So, excuse me, our cases are remain good, but still concerning. With regard to vaccinations, and let me just point out, the trees are blooming again, so I'm coughing again. So with regard to vaccinations, Saturday, the city held its 14th mass vaccination event. We vaccinated first doses right at 1,500 people, second doses right at 200 people, for a total on Saturday of about 1,700 doses. In addition, on Sunday, we did 316 doses at the Housing Authority. Those were second doses. And so we just continue to do these mass vaccination events. We are expecting to be able to announce a what's called a mega vaccination event in coordination with the state. So hopefully sometime this week we'll be able to announce that. We are working with them on that. Somebody said to me, what's a mass vaccination event and what's a mega vaccination event? I don't think there's a solid description for that, but we would expect probably to do about double the doses when we partner with the state that we're able to do just on our own with the 14 mass vaccination events that we've held. I do want to point out that so far almost 38,000 people in the city of St. Louis, to be exact, 37,443 people in the city of St. Louis have received at least one vaccination, and another, what is it? I don't have the number in front of me. How many second vaccinations? Do you know that? Never mind. Okay. So I think the most important number is how many people are in the queue to become fully vaccinated. And we've got these 38,000 people who have received first vaccinations.
Total doses is 58,005.
Okay, thank you for that. Total doses 58,005. So about 20,000 people have both a first and a second dose in the city of St. Louis. And the events that we have coming up, which will be on the 27th and the following 3 weeks, will all be second dose events, because for the last 3 weeks we have been giving Moderna, the Moderna vaccine, and the Moderna vaccine, you have one shot and then 4 weeks later you have the second shot. So we're hopeful that we will be getting some of the Johnson & Johnson soon, and we're working with the state on that. It's likely that the mega event will use Johnson & Johnson. That's a real plus because it's a one-shot vaccine, and also very effective at keeping you from getting really sick and hospitalized and potentially dying. So that's the most important thing. Does the vaccine keep you from getting really sick? And the Johnson & Johnson has proven to do that. So we're looking forward to that. We're going to continue to just administer as many vaccinations as we possibly can, and to partner with the state on a mega vaccination event that we hope to announce here shortly. If you have the opportunity to get vaccinated through your hospital, through other locations, CVS, Walgreens are there's 4 stores in the city of St. Louis that are giving the event. We need to post, Tommy, if you can post, it's called Vaccine Finder, and it's just a list of all the places where you might be able to get the vaccination. So if you have the opportunity to get the vaccination, take it at your first opportunity, and you will, I think, be well served, no matter which of the vaccines it is. So, you know, tomorrow marks exactly 1 year since the city of St. Louis announced its first case. It has been a heck of a year for all of you, I know, and for all of our businesses. We have, I think, responded very deliberately to keep people safe and to keep people healthy, and also try to keep as many people employed as possible. It's a balancing act that I think really has been good because of how all of you followed the mandates. City of St. Louis people are, by and large, wearing their masks, social distancing, and those are reflected in our numbers. As you all know, over the last year, we've done many, many things to help people with stay in their housing, stay in their apartments or their homes, to help people keep their utilities on, we stopped all water department disconnections. We have received $64 million in Department of Human Services funding through the federal government. We've gotten that out to various agencies, community service, CDA. So we have, over this past year, I think had just a very active day-to-day management as best we could in order to keep people safe and in order to keep as many businesses as possible open. I know that many people are wanting even more relaxing of some of the restrictions, and we are certainly want to do that as well, but as you see, we have a little uptick in the numbers right now. We're concerned about the variants, and So that's why our focus is certainly on getting shots in arms. I also want to say that one of the things that, it's been 1 year and it has been a heck of a year. But we also have to remember the 439 St. Louisans who lost their lives to COVID. We've got to keep their families in mind. This has been just a very devastating virus for our community. And last year, on this day, I doubt any of us were thinking that we would still be doing this a year from now. And it looks like we'll be doing this for a while longer, although our numbers are down, and we hope that they will stay down and go down even farther. We certainly want to remember those 439 St. Louisans who lost their lives. So, I think that's all I have for today, but certainly happy to take your questions.
A couple of questions. So, some folks did write in about the new phase that the state moved into and when the city of St. Louis might be able to begin vaccinating folks in 1B Tier 3.
Very good question. Thank you. I should have mentioned that. So today, Tier 3 becomes able to be vaccinated. That is government workers, it's teachers, it's child care workers. We are continuing, though, to focus on those over 65 and those with underlying health conditions. And that's because we still have so many people in that population that have not been vaccinated. So that is our focus. Now, St. Louis Public Schools are partnering with the National Guard and with the Urban League, and they are doing vaccinations for teachers today through Thursday at Vashon. You do have to have teachers do have to have an appointment. St. Louis Public Schools is managing that. So we all want teachers to be vaccinated, as we all want kids back in school. And most of our kids here in St. Louis are back in school, in classroom school. But right now the city is going to continue to put our focus on vaccinating people over 65 and those that are under 65 but who have underlying health conditions.
We did get a follow-up question about the American Rescue Plan from Chanel and what the city is thinking about how to invest that sum of money in and what it will be used for.
So Chanel, we are working on that right now, but as I've said before, people are hurting in St. Louis. People have lost their jobs. People have had their hours cut. Many people have been struggling economically as well as being concerned about the virus. So our first intention here is to make sure that this gets to the people who need it the most. Now, along with the, I'm calling it the ARP, American Recovery Plan, which is giving money to cities. Cities are also, through this funding, able to replace some of the revenue that we have lost, which is as much as $70 million in each year, in order for us to continue to provide services to our residents and our businesses. So we will also be doing that. We also expect to help businesses. Now, in addition to what the money that the city is getting, of course, individual checks. Some of you who are watching today have probably already received the $1,400 per person stimulus check. We say check, but usually it's really going direct into your bank account. Those amounts started coming out. I heard of them hitting some people's accounts last Friday, and they will continue over the next week or two. So $1,400 per person. In addition to that, there's going to be additional help for parents with kids under 18, $300 a month for any child that's 6 or under, $250 a month for any child who's over 6 to 17, I think it is. And that, of course, is income based on your income, but that certainly will help a lot of working families. So between the stimulus money, if you're a family of 4, you'll get a stimulus check of $5,600, and then you'll continue to get either $300 or $250 per month per child for the next year. So there is a lot of help out there for people, which is going to be coming. And I mean, honestly, I say it's a lot of help. It can't come soon enough. Our residents and our people are hurting, and you know, thankfully, President Biden signed it. I think it was last Thursday, so it's only been 4 days ago, and already some of those funds are getting into the hands of the people who need it the most.
Joe's question, are we seeing yet the state of Missouri sending more vaccine to urban areas to meet the demand here?
We are. We're getting some more vaccine, and we're working closely to get these mega events here in St. Louis. It looks like we may get 2 mega events, and when I say St. Louis, in the city of St. Louis, but also St. Louis County. St. Louis County has had more vaccine because they are a high throughput vaccinator, but still we need to continue to get more vaccine here because we have a high number of people that are over 65 or have underlying health conditions, and we have a high number of people who want to get the vaccination, thankfully.
Todd's question is, Mayor, could you please remind people that restrictions and recommendations need to stay in place because we haven't reached herd immunity, but at the same time that we are not locked down?
Well said, Todd. As Todd just said, yes, we are nowhere close to reaching herd immunity. We do have a 3.5% positivity rate on our caseload, but still a lot of people out there who have not had COVID, who have not had the vaccination, and who are susceptible to getting it. So our mask mandate remains in place. The 6-foot social distancing for right now is remaining in place, washing your hands. We're seeing some benefits from this. I think you all know this. I mean, we're not seeing flu this year, thankfully. And part of that is just because we are all using these mitigation practices, which is keeping us healthier all the way around.
Gregory's question on vaccine has to do with whether you anticipate vaccinations will be mandatory for employees to return to work or for businesses to reopen. Gregory,
I don't anticipate that being vaccinated will be mandatory. This has been talked about a lot. Right now in the entire country it is voluntary, and so through persuasion we're trying to encourage everyone to get the vaccine at their first opportunity.
And Angie's question is about masks, asking you, Mayor, could you please remind people that masks do in fact still work?
Angie, you guys are doing a great job helping me out here today. Yes, masks do in fact still work. And masks indoors in public spaces are required unless you're seated at a table eating or drinking in a restaurant. They are required when you're out shopping, whether you're grocery shopping or at the mall or just running into a quick shop. Masks are required indoors, and they're required outdoors if you're within 6 feet of another person. So
Denise has signed up for the city's notification system.
Mm-hmm.
Curious when she can expect to get an invite and how much progress we're making of the people who have registered.
Well, Denise, I don't know what your exact situation is. We are working off of our list for the 14 mass vaccination events that we have done. So many people have gotten invitations. Primarily, we have done it in the order in which people signed up, between that and your zip codes. So when we did a vaccination event at the Omega Center, we invited people from the zip codes right around that area. So if you are over 65 or if you have an underlying health condition, you should be, in the not too distant future, receiving an invitation. If you are not over 65 or don't have an underlying health condition, then it's probably a ways away, although you heard that the president said 4 or 5 days ago that he expected by May 1st that there would be a lot more vaccine out there. I think that will be the case. And we are working hard to make sure that you can go to a neighborhood pharmacy to get an appointment. There are 8 pharmacies in the city of St. Louis where you can get an appointment now, unless they're filled up. You know, they may be filled. And that's why I think we just posted, or we will post in a second, this what's called Vaccine Finder, Vaccination Finder. So
That's all for questions today, Mayor.
that's all today? All right. Well, thank you all. Appreciate you being with us today. Remember, tomorrow is the 1-year anniversary of our first COVID case in the city of St. Louis. It has been a long year, but we have made a lot of progress together, and I just want to thank all of you for following the mitigation strategies. And let's just remember the 439 St. Louisans who are no longer with us. Thank you all.